let's talk about voice and alaryngeal voice and what we do for treating, assessing, and writing goals for these two particular areas. So the basics of this one, their learning objectives are just knowing the basics of a voice assessment, being able to discuss the qualities of the alaryngeal speech, and then being able to write those voice-based goals. So here are the kind of content, the order of agenda on what we're going to talk about in this particular lecture. And so again, we do have to talk about treatment, even though this is, of course, primarily talking about assessment, but we have to talk about treatment because you need to know the treatment before you are able to pick the appropriate goals for these clients. So it's really critical just that you do know that, and that is why we're going over treatment for these particular populations as well. So we're going to talk about the voice disorders and the different types. And so there's organic, neurogenic, and functional. So just keeping in mind that there are multiple different voice disorders that a client could be facing, from a range of structural all the way to psychological. And please be very, very cautious here that when you're looking at functional, that you're not mixing up transgender and psychological. Those are two vastly different things that are going on. And so we don't ever want to misrepresent a transgender voice as being a psychological disorder. So just be very cautious of that. So here are some different disorders that a client could face if we're talking about organic disorders and what they might look like in the throat. And so maybe I should have warned you this was kind of a gross slide. Well, maybe some of you think it's really cool, but just things that you want to think about and what it might look like if you're looking at the larynx. So thinking about this being our very healthy larynx and what it looks like, and then being able to identify those nodules and then an ulcer and then that webbing that takes place on the larynx as well. So lesions and cancers, swelling, all sorts of things can be a part of those organic disorders. And so when we went to talk about neurogenic disorders, here's where we're going to talk about things such as Parkinson's. And so Parkinson's is one that you are really going to encounter a lot as a speech language pathologist. You are going to experience a lot of patients who have Parkinson's and what that voice is going to sound like. And of course, you'll experience that cranial nerve 10 that whenever that damage takes place as well. And there's lots of different ways how that damage can take place. But just other ways that we can have neurogenic disorders. But it's just really important that you are aware of what that might look like. And then just take a look at these pictures down here on the bottom as well so that you can see the difference between a paralysis and a cord adducted. And so just look very closely, make sure you familiarize yourself with those particular pictures. And then lastly, we have functional disorders as well. So being able to talk about gender affirming voice or psychogenics or even just muscle tension. And here's the big question. Where are those true vocal folds? So we'll talk about this in class and let you kind of look at this again, but take a minute to look at this and see if you can identify where those true vocal folds are. Can you identify them and being able to point those out? So that'll be really critical as a speech language pathologist, that is something that you are able to do. So what do we do about treatment? So we have various treatments depending on what's going on in the voice. So if the client has experienced a hyperfunction, so something is going so that it's a hyperfunction, so in attention, so to speak, we have lots of options such as relaxing those muscles in a confidential voice. So remember, I apologize. This right here is not whispering. We are not teaching a client to whisper. So whispering is incredibly bad for the voice, and we never want to teach a client to do that because it's training the vocal folds to stay open constantly. So a confidential voice is being able to talk softly without a whisper. And you might see this hyperfunction due to abuse or misuse. So it might be an abuse or a misuse of the voice. And as many of you know, it's very ironic that I'm teaching a voice disorders class right now, and you can hear in my voice that it is still not fully healed from the Kasha event from over the weekend, from not this past weekend, but the weekend before, where I was screaming like crazy. So that's that abuse of the voice. And so being able to talk more in a confidential voice, making sure that I was suppressing my cough, these are things that I've been doing. And then also just putting myself on vocal rest. So vocal rest is a big one as well. So just not talking unless absolutely necessary. And so we have a lot of other options, but we want to see what is going to work for our client. If they're experiencing this hyperfunction, which one of these particular approaches might be reasonable for them to be able to use, right? On the flip side, if they have hypofunction, so a reduction, so it's hypo, it's not tense, it's very loose, right? So hypofunction. Here are some examples that we might want to give to them. So this pushing and pulling. So literally practice this. I want you to link your fingers together, pull in opposite directions, and produce ah, right? Or ah, you can do ah, whatever you want to do. I don't really care. Probably shouldn't do some more vocal abuse on my poor voice right now. We have function exercises as well that can have clients do, and increasing their loudness. So this could be because of incomplete closure of the vocal folds. So that's that hypofunction. So we don't have that nice closure of the vocal folds versus hyperfunction. So that's like intense, like really intense tension that is happening in the voice. So practicing things like increasing loudness. So I want you to practice this. Lay down with one hand on your chest, one hand on your abdomen. Exhale through the mouth. Relax the abdomen during inhalation. Tense during exhalation, and produced prolonged vowels while increasing volume. Right? So, oh my gosh, here we go. Anyone who can yell vowels out the window, name that movie, right? Can we yell our vowels out the window while laying down? So these are just some techniques. So again, talking through your client through if they're experiencing hypofunction, we want to be able to say which one of these particular exercises is going to be the most beneficial for you prior to writing those goals for the client. And then finally, your psychogenic. It's a big part of listening, that active listening that we've talked about so many times in class, thinking about client education, making sure that we're thinking about, what is going on with this particular client, and helping them to be able to start with just those vegetative sounds. Remember, vegetative sounds like the sounds that a baby makes, and then move through vowels and words and sentences. So it's kind of similar if you were working with a selective mute individual, as person with selective mutism. So that's kind of a similar approach. Theirs is not a voice disorder, but it is a similar approach that you could consider. And then always with this one, we must make that referral. This is absolutely critical because there's an underlying element that's going on that's really, really critical, that we are making those referrals for emotional factors. And any of our patients that we're going to see with psychogenic challenges, this is going to be because there is going to be an emotional factor that's underlying this. So it absolutely is critical that referral is made. So what do we do in an evaluation? What is our job? What does that look like for us? So here's a little, just a basic evaluation. And notice that it's really similar to our motor speech as well. So just getting that client history like we always do. This is really critical, making sure that we're asking them, how are they feeling, how it is impacting their life, because the way that we perceive someone's voice is not going to be the same way that they perceive their own voice. So maybe some of you didn't even realize that my voice sounded raspy until I mentioned that. But to me, I can still hear it in my voice that it's not 100% back to where it was. So that's just something where you need to talk to the patient and ask them, how are you feeling about your voice? How do you feel about your performance? Because that's going to be really important for us to take that into consideration as well. As always, we've got our oral mech and our hearing that we always want to make sure that we're doing. And then we're looking at that respiration, auditory perception, and then we need to look at frequency and intensity, and then stimulability for various things. So making sure that we know how long can you respirate, what is the intensity, your frequency, and what can I probe you for. So here is what is awesome. Notice a free perception of your voice. So this might be too small on your screen, so do take some time to just pause and zoom in to make sure that you can see this in case this is too small on your screen. But this is going to give us that insight and the expectations of the particular patient. So we want to know, how are they feeling? What do they feel like is going on? And how can we help moving forward? One of the other parts that we're going to do, your CAPE V is a really common one that you're also going to be doing. So you will need to familiarize yourself with this. And we most certainly could practice this in class if people feel like that would help. We can try to do a little practice in class, so just let me know. So what we're going to do is we're going to listen to the voice and rate how it sounds compared to norms. So I know this can get a little bit tricky, right? Because norms are subjective, but what we're looking for really is, is there roughness, breathiness? Are they straining? And, just other parameters, like the voice just doesn't sound healthy for one reason or another. And then we're going to make these tick marks to rate. So you'll probably have to zoom in, right? So that you can get a little bit of, here you go, a little bit more information. So making sure that you're following these directions. So going through these directions up here, looking up here, and then here's the legend on where and how we'll make those tick marks, right? So that mild, moderate, and severe. And then we're going to give them that rating as well. So just make sure you read through those directions. And even you can practice with some friends, or if anybody has a little vocal abuse, or if you really want, you can do it to me. You can listen to this lecture and you can give me the CAPE V. And then what we're going to do is we're going to measure that distance, right? So we're going to measure and put that tick mark. So in a couple of slides, there's an example of what that looks like. So you'll be able to see. And again, we definitely can practice this. So the next slide that we're looking at here this is an actual evaluation of a client. And what you'll notice is that she has a horsey voice, the horsiness in her voice, and she has those nodules. So notice that they are bilateral. So that means that they're on both sides. And we're going to take a listen to her voice. Please note other things that are being evaluated. So making sure that you're going through and talking about, other things that could be happening in the throat, like other things that could be affecting the voice. We're looking at that, any trauma that could be caused, such as alcohol, smoking, things like that. Your caffeine consumption, that is a big one. So if you're drinking a lot of caffeine, you're not drinking your water, you drink a lot of alcohol, those sorts of things, all phonotrauma to the vocal folds. So it's important that you note that we know what's going on. And then looking at how this is impacting both social and the person's work, because we want to say, okay, is there any impact? So you might be complaining about the voice, but does it have an impact? And so for this particular person, yeah, they're part of a choir. So this is going to be a big issue if you have trauma or your voice is not as strong as you need it to be if you are a singer. And so we want to just take that into consideration. One of the people that you probably know pretty well, famous person who had lots of nodule issues, was Adele. And so probably many of you have heard about the issues that she had where she had the nodules and she had the surgery and all sorts of things. But obviously for someone like that, having nodules is going to have a massive impact on your life because you rely on your voice in order to be able to sing. And that's your whole livelihood. So we always want to take that into consideration. And then, of course, the testing that is going to take place as well. So let's take a listen to this particular patient.
Patient number 32, female, age 62. Diagnosis, vocal fold nodules.
A lady standing, washing dishes, water is spilling on the floor. A young man standing on a stool that's about to fall, reaching for cookies. A young girl standing with a hand extended out for cookies. Wish to know all about my grandfather. Well, he is nearly 93 years old. He's dressed.
Oh, I apologize. Sorry, everybody.
Patient
as ever. A long, flowing beard cling to his chin, giving.
All right, so you'll notice, especially with that max phonation time, you notice how her voice did this kind of waver where it kind of sounded like there was a wave within her voice. So that's something that we would want to take into consideration, and you can hear the hoarseness of her voice. And if it wasn't totally clear to you, go back, take a listen again, and then do your own. How long can you phonate, and what does your phonation sound like if you don't have any vocal abuse right now? So it's just part of our assessment. Additionally, here we're going to do that self-assessment as well. So how is she feeling about it? So she's saying sometimes people have difficulty hearing her. And this where she says, I feel as though I have to strain to produce my voice. And she's saying this all the time. So imagine having to strain to produce your voice all the time. This would be incredibly challenging. And so here's that eval as promised. So here's what it would look like. So taking into consideration what are the challenges that she has. So we have that roughness, overall severity just above that moderate, and then thinking about breathiness, and she's very strained, but her loudness was very much in the mild impact. So again, let's take a look at this voice. So you can see those bilateral nodules. So can you identify them? Are you able to see those nodules? So do you see where they are causing issues in the vocal folds, right? So not allowing that closure to take place. So causing that breathiness and some severe issues going on in the voice. So really critical that we understand that. The next portion that we want to talk about are goals, because our goals for a voice patient are going to, again, look really different than the kids. So we wrote those really great kid goals, but remember, motor, speech, and voice is going to look different. These are patients. Usually these are going to be adults. Although, keep in mind, voice disorders occur very commonly in children as well because of vocal abuse. But goals are going to look really different. So, and you have to take into consideration, what exactly are we targeting of this voice? So for this particular one, respiration and phonation, you'll see that we're trying to get them to phonate for longer than 8 seconds with minimal cues. So again, not really identifying those cues, but what is the purpose? The purpose is to be able to get longer mean length of utterance per breath. So just keeping in mind like that the structure of these goals will be a little bit different. If you're looking for loudness, right, that we're looking to be able to increase the decibels in a conversation. And so, again, I didn't write these goals. You all know that I wouldn't have written that, but these goals are given to me by someone who uses them, but I just want to give a little call out for that. And again, we're just saying minimal cues because we have to keep in mind that our cues might change from time to time. And what's the purpose? The purpose is to increase intelligibility. And so always thinking about that functionality. What is the function of this voice? And then finally, another goal that's going to be really common for you to use is a vocal hygiene goal. So a lot of our patients that we're going to see have poor vocal hygiene, whether that's not drinking water, whether that's eating things or drinking things that are really abusive to the vocal folds, or for example, in this one, throat clears. Oh my gosh, no, don't do it. Don't clear your throat. And so we want to make sure that we are really educating our clients on why we do not want them to be clearing their throat. And so again, not specifying the cues and what's the purpose. We're improving vocal hygiene and endurance and vocal comfort. So when we are clearing our throat, this is this very aggressive thing that's happening in our vocal folds, and we're clearing our throat, and it's just like trauma all to the voice. So really wanting to teach our clients not to do that. And even a client with a chronic cough, teaching them different types of coughs that they can do. So again, it's not this abrupt like slamming of those vocal folds, like boom, boom, boom. Oh, here we go. We're just abusing our voice so horribly. So vocal hygiene is a goal that you definitely will be writing for most of your voice patients. I have never seen a voice patient that I didn't give them a vocal hygiene goal. Most of the patients that I saw, it was more vocal hygiene for drinking water, because a lot of my clients were really anti-drinking water. And so, of course, if we don't drink water, we are very much in the vocal hygiene. We're having very, very many vocal hygiene issues. So it is really important that we give our clients the education on that. All right, so let's move into transgenders or gender affirming voice therapy and what our job would entail. So for our particular job, we want to think about the goals of the client. And so we have clients who are going to come in who maybe they're feeling really confident and we're doing our assessment and we're talking to them and we're figuring out like, hey, what do you want to do? And they're just really excited about this. But on the flip side, you could have a client who comes to see you who is not feeling confident, who is really feeling overwhelmed. They have a lot of trauma that's going to be associated with this, whether that's just because the way that their voice sound doesn't match with their identity or how they're presenting. So if they're presenting female or if they're in the mix of transitioning, these are things that you want to think about when you're talking about gender affirming voice. And we want to take this into consideration that one day our client could feel really confident and be having a really great day. And the next day, due to a wide variety of issues, our client might not feel that way anymore. And they might be feeling extreme sadness and extreme trauma. So we don't want to add to that sadness and we don't want to add to that trauma. So please be very cautious that you are avoiding microaggressions, that you're not shooting on them, please. That's definitely something we want to avoid. And we're not mandating any kind of goals for this particular client. Writing goals for a gender affirming goals for a transgender individual, this is going to be really critical that this is done together, that you are writing these goals with your patient, that they are able to have a huge input because this is their voice, not your voice, not somebody else's voice. This is their voice. And so it's really critical that we are not telling them what their voice should sound like or writing goals about what we think their voice should sound like. So just keep in mind that there are a lot of things that we would be working on with gender affirming voice, and we want to make sure that we are being very supportive to our clients. And so that's going to be the wrapping up of the voice section. And so we're going to move into alaryngeal speech next. So alaryngeal speech basically just means that your voice is coming from a source other than your larynx. So this is there's a reason why this would happen, and so for a lot of the patients that we're going to see, this is because of a laryngectomy. So patients might have a laryngectomy for multiple reasons. A couple of them are listed here on the slide, but what you can see is here's where the larynx was, and it's being taken out. And so now they're no longer able to produce their voice from the larynx. And so what you'll see is this stoma gets implanted. And so this is where the voice is going to come from moving forward. So we have a wide variety of things that we can do for treatment. And what I did was, you'll notice that there is actually between these two slides, there is this particular video. And I'm not going to play this right now. You have access to this on Canvas. So please take the time to review this video. It's really, really critical that you understand the various types of treatment. And in this video, she does a really, really good job of going over all of the treatment approaches many treatment approaches for alaryngeal voice. And so I want to make sure that you are familiar with that. Excuse me. So part of our evaluation is actually doing a prehabilitation. So we really want to counsel, educate, make sure we're explaining what's going to happen, what's this going to be like. And it's really critical that we connect our patients to support groups. They may choose to not go. They may say, I don't want to go, I'm not interested in that. That's fine. But it's our job to make sure that we at least tell them about support groups. And we might even want to talk to them about the option of an AAC. Because remember, alternative and so it's augmentative and alternative. So we want to make sure that we're really counseling our patients on what is an AAC, how can it be used. It's not necessarily taking the place of your voice. It could just be adding to or helping you to have more clarity when you're having conversations with people. So just making sure that that education piece is there. That's really, really, really critical. And making sure that we are answering all of their questions post-surgery and talking about what's going to happen post-surgery and answering any questions that they might have before they go in. So after surgery takes place, you do have two particular places where you might see a client, so in the hospital and then outpatient as well. And so communication is really, really key here because we want to make sure that our patient has a way to communicate. Their whole life is about to get flipped upside down. Their larynx is literally being removed from their throat. So we really want to make sure that we give them a way to communicate immediately. And then once the ENT allows it, we do want to check for a swallow eval and just continually counsel. That is so critical, and it's such a big part of what we do with our Alaryngeal speech individuals. And looking at that quality of life and talking to them about like, hey, how are you feeling about your life? How can we help? Those sorts of things. And then lots and lots of referrals. So you'll see that they're going to be seeing lots of different people. They're going to have lots of different referrals. So we do want to be very sensitive to that as well. Our alaryngeal patients also have their quality of life. So you can pause and you can kind of, you can zoom in on these, and you can look at each one of these sections that you can see your patient would fill this out, kind of just to give you an idea of how they are feeling about their voice and the quality of their voice. So let's take a look at an eval. So here is a particular client who's 60, and because of chemo, what we're going to see is that laryngectomy was performed. And so when the laryngectomy was performed, you have to look at the various stages of what's going on. So what was that diagnosis? That's, this is just going to go in our report, and talking about, that current diet and what were the results of the test and those sorts of things. So please note, look here, his particular quality of life, there are a lot of concerns, right? There's a lot of anxiety in our client. And this would be super annoying for any of you who got COVID, and that was one of the symptoms. I've heard so many people talk about how that was so annoying, just not being able to smell, and just various things that our client could communicate to us that we need to be able to listen to, right? So think about if you had to write or point to everything in order to get your wants and needs met, and trying to learn how to use an electrolarynx. Like, this is really challenging. So notice how this patient, they're not yet using it. So they have it, but they're not really sure how to use it. So how is this impacting our patient's quality of life overall? So what you'll see is the patient's going to circle how they're feeling. And then we would go back through and we would just rate this based on what the patient shared with us. So really critical that in our evaluation that we are taking all that stuff into consideration and looking at the patient as a whole to say, how are they doing? How are we going to support the patient? So again, this is another video. I'm not going to show it now, but please do watch it on Canvas. Really critical that you watch that as well. So again, our goals are going to look quite different, but at this point, they might start looking pretty familiar to each other. And these are real goals that have been given out to multiple patients. So in this particular one, this is a swallow goal. So remember, clear it with the ENT. Make sure you have that clearance from the ENT before you do a swallow eval. But we want to have the diet, we want to have the patient tolerate different types of diet, right? And so the whole purpose of this is so that they're able to transition from tube feeding to eating 100% by mouth. Right? So we want them to be able to switch. So we don't want them to have to totally eat by that tube feeding. And many people talk about the importance of being able to eat out with their families. And so this is going to be something that's really important. So especially if you come from a culture where a lot of your cultural based activities, holidays, things that you celebrate, all of those things are based around food and the types of food. This would be really, really critical for a patient from a culture like that. And in reality, I don't really know any cultures that don't have multiple holidays that center around food. We all love our food, right? It's just great. So other goals that you might see is things like protecting their airway and breath in a new way. So this is all new. So they have to protect that stoma, learning how to keep that clean, learning how to make sure that there's no infections, nothing going on in there, and being able to put it on and take it off appropriately with no cues 100% of the time. And this is really critical that we don't get down to this 80% or 90%, but no, they need to be able to do this 100% of the time, and they need to be able to do it independently, because this is going to be really critical for the health of our patient. So if we're not able to be there with them, we need to know that they can do this all on their own. So this is what a goal might look like for this particular patient. Other things like being able to maximize their taste and smell. This is going to be something that we would want to focus on for our patient as well. And then finally, a communication goal. So learning how to just use that electrolarynx device, because they take some time to get used to. Like any other new way of communication, they do need practice with that. So even if you're going to give them an AAC, that's totally fine. An AAC is an option, but they have to learn how to use that and navigate that as well. If it's an electrolarynx, we're really looking for that intelligibility piece, because if you've ever talked to anybody who has an electrolarynx, it can be challenging at times, especially in noisy environments. I actually know someone who I met from various people through lots of different people, and basically we were having a conversation one time at a bar, and it was extremely challenging to understand what he was saying because the bar was very noisy, and the electrolarynx it doesn't function the same way as your regular, just your vocal folds. And so it's really critical that we are helping our client to learn how to use that electrolarynx as well. All right, so make sure you come to class with all the questions that you might have. Give some practice to some of those treatment techniques. Try to find those true vocal folds. Take a look at those various, like maybe gross pictures, maybe cool pictures, depending on how you feel about it. And just come with questions that you might have and talk. We're going to talk about what are our roles and talk about when we're writing an assessment, and we'll practice writing that assessment as well. All right, everybody, have a great night.